Psychiatric service dogs play a vital role in supporting individuals who live with mental health disabilities. These dogs are not emotional support animals, and they are not pets. They are highly trained working animals who perform specific, measurable tasks that directly mitigate the symptoms of psychiatric disability. In this video, I'm going to walk you through what psychiatric service dogs do, how they help, and why they are so effective for people living with conditions such as PTSD, severe anxiety, panic disorder, major depression, bipolar disorder, and other psychiatric impairments. A psychiatric service dog is defined by one core requirement. The dog must be trained to perform tasks that directly assist with the handler's disability. These tasks are not optional, and they are not general obedience behaviors. They are disability-related skills that allow the handler to function more safely, more independently, and with greater stability. This is what legally separates a psychiatric service dog from an emotional support animal. The service dog performs work. The work must be trained, and the work must be tied to the handler's disability. Psychiatric service dogs support a wide range of mental health conditions. Individuals with PTSD may rely on a dog to interrupt flashbacks or provide grounding during dissociation. People with panic disorder may need a dog trained to recognize early physiological signs of panic and intervene before the episode escalates. Those with major depressive disorder may benefit from task-based motivation, such as nudging the handler awake, interrupting harmful rumination, or prompting daily routines. Individuals with bipolar disorder may rely on a dog to help stabilize sleep cycles or provide grounding during manic agitation. These dogs are trained to meet the specific needs of the handler's diagnosis. Task training is the heart of psychiatric service dog work. These tasks are not emotional comfort. They are functional skills. Examples include deep pressure therapy to reduce physiological arousal, tactile stimulation to interrupt dissociation, alerting to rising anxiety, retrieving medication, guiding the handler out of overwhelming environments, waking the handler from nightmares, or performing room searches for individuals with trauma-related hypervigilance. Each task is taught with precision, repetition, and consistency. The dog learns to perform these tasks reliably, even in public settings. One of the most common tasks for psychiatric service dogs is deep pressure therapy. This involves the dog applying gentle, sustained pressure to the handler's body. This pressure activates the parasympathetic nervous system, helping reduce heart rate, lower cortisol, and interrupt escalating anxiety or panic. Grounding tasks also play a major role. A dog may nudge, paw, lean, or make physical contact to bring the handler back to the present moment during dissociation, flashbacks, or intrusive thoughts. These tasks are trained to be calm, predictable, and effective. Psychiatric service dogs can be trained to interrupt behaviors that may be harmful or destabilizing. For individuals who experience self-injurious urges, repetitive harmful behaviors, or severe rumination, the dog can intervene with a trained behavior such as nudging, pawing, or redirecting the handler's attention. This is not emotional comfort. It is a trained interruption designed to break the cycle of harmful behavior and redirect the handler toward a safer, more regulated state. Many individuals with psychiatric disabilities struggle with daily routines, including medication adherence. A psychiatric service dog can be trained to retrieve medication containers, bring them to the handler, or alert the handler at specific times. The dog may also assist with morning routines by nudging the handler awake, encouraging movement, or prompting the start of the day. These tasks help maintain stability and reduce the risk of symptom escalation caused by mismedication or disruptive routines. Psychiatric service dogs must be trained to behave appropriately in public. This includes ignoring distractions, remaining calm in crowded environments, and staying focused on a handler. In public settings, the dog may guide the handler to exits during panic episodes, create physical space in crowded areas, or block individuals from approaching too closely. These behaviors help the handler feel safer and more in control, especially in environments that may trigger anxiety or trauma responses. Psychiatric service dogs are protected under the Americans with Disabilities Act. This means they have full public access rights, including access to stores, restaurants, transportation, and other public spaces. However, with these rights come responsibilities. The handler must ensure the dog is trained, well-behaved, and under control at all times. The dog must not disrupt the environment, show aggression, or behave unpredictably. The handler is responsible for maintaining the dog's training and ensuring the dog performs tasks reliably. Psychiatric service dogs are effective because they combine trained behavioral intervention with consistent emotional stability. They provide structure, grounding, and task-based support that directly mitigates symptoms. Their presence reduces isolation, increases independence, and improves daily functioning. For many individuals, a psychiatric service dog becomes an essential part of their treatment plan, working alongside therapy, medication, and other clinical interventions. Psychiatric service dogs are not a quick fix, and they are not emotional support animals. They are highly trained working partners who provide life-changing assistance to individuals living with psychiatric disabilities. To conclude, this overview of how psychiatric service animals support individuals living with mental health disabilities, you may be considering whether a psychiatric service animal could be clinically beneficial in your circumstances. If you are uncertain, you can schedule a private and confidential evaluation at carehavenpets.org. This site also provides additional resources, including tools such as music interventions that can be integrated into your broader treatment plan alongside a PSA. Thank you for taking the time to learn about this important topic. I look forward to continuing this discussion in future videos.